I'm Rana and I'm the statewide Principal Oral Health Advisor. My role is to inform clinical decision making about clinical care provided across our agencies across the state. I am responsible for supporting our dental workforce to provide evidence-based care that is in the best interest of our eligible population. Oral health care is now, more than ever, connected to a larger system of stakeholders, regulations, expectations, accountability, and risk. The focus of my review is clinical decision support, defined as any computer program designed to help health professionals make clinical decisions, deal with medical data about patients, or with the knowledge of medicine necessary to interpret such data. Over a decade ago, information systems in dental clinics were already relatively matured in providing logistic and administrative support. However, these systems were usually designed primarily to facilitate administrative functions centered on billing or, at most, automating functions such as appointment alerts and reminders. There was still a prominent lack of advisory features such as decision support for clinical functions. Clinical decision support systems are only now beginning to be developed in dental applications and have the potential to not only increase quality of care and enhance health outcomes, but to avoid adverse events and improve efficiency, cost benefit, and provider and patient satisfaction. There is the potential for implementation on decision support technology at DHSV, hence the focus of this review. A systematic literature review was conducted to assess the published studies that reported on clinical decision support in dentistry. A broad computerized search was conducted of the following databases: PubMed, Embase, Web of Science, CINAHL, and Cochrane Library. The search was conducted using the keyword search of the following combinations: oral health, dental informatics, decision support, database, diagnosis, with the prefix "and". The term clinical was not included due to the possibility of overlooking potential articles. Only articles published between January 2015 and December 2016 were included in the search. A single reviewer selected the articles based on the title and abstracts and checked the contents. Articles that did not clearly fulfill the inclusion criteria were excluded. During the evaluation process, reference lists were searched by hand for further articles, which were then excluded if they were duplicated. Following full text review, one more article was excluded. Of the remaining 15, the top 5 articles were chosen. There is general consensus that the use of clinical decision support systems will have the potential to improve patient and treatment outcomes. However, there is actually a paucity of evidence available to analyze its potential benefits within dentistry. The rationale for choosing the following 5 articles were that they most resemble a typical decision support system as illustrated by Go et al., making them comparable to other decision support systems in the field of medicine, and that they also demonstrate the future potential of these tools in terms of applicability, improved efficiency, epidemiology, and/or patient-provider satisfaction. This study compares clinician attitudes, skills, and motivations pre- and post-implementation of 3 EHR-based clinical decision supporting tools, including caries management by risk assessment, periodontal disease management by risk assessment, and a risk assessment-based proactive dental care plan. It specifically examines the experience with the tools in a large dental practice in order to shed light on the effect that implementation of these systems have on the clinical provider's work experiences and perceptions. The clinician demographics is outlined. This study demonstrates not only a significant improvement in formal training, knowing how to use the tools, belief in the science supporting the tools, and the usefulness of the tool to motivate patients, but also demonstrates clinicians were motivated to use evidence-based tools to help improve patient care. There is often a lack of utilization of risk assessment prior to treatment planning in dentistry, and this often leads to care that is tailored to the presenting complaint rather than the patient. By incorporating an integrated tool within their EHR system, they were able to place the right information in the right place, which led to a wonderful solution, namely 98% adherence to the CDS risk assessment tools, most definitely improving patient outcomes. Tooth whitening response is affected by multiple factors, including those related to the patient, including the patient's age and tooth hue, and can often be very difficult to predict. Too often, the decisions are based on limited knowledge, the information is incomplete or imperfect, and the decisions must be made during a limited period of time and based on different clinicians' visual acuity. This study evaluated the system performance of the EasyClick Tooth Color Predictor, which has proposed a multiple regression analysis approach in order to model a set of pre-bleaching and post-bleaching tooth colorimetric values by using a set of rules whose antecedents correspond to the chromatic coordinate values. By evaluating the accuracy of this system against the new patient data, the system was found to be highly accurate in predicting tooth color changes after bleaching, demonstrating that the decision support system is possible to predict the color change obtained using an in-office whitening system using colorimetric values, removing some of the clinician variance, improving their confidence in being able to provide patients with a more accurate picture of what their treatment results are likely to be. When it comes to the provision of public dental care, removable partial dentures remain a primary treatment for most partially dentate patients in order to maintain oral function and appearance. This proposed decision support model would be a very useful reference for dentists in drawing design sketches in routine practice. In this study, the EHR database and new patients are both sources of input. After the instantiation process, which was guided by this ontology, the input data was standardized. Case-based reasoning began through cosine similarity between instances in the ontology and input as illustrated in the diagram. The treatment of similar cases informed the final output, which demonstrated comparatively good graded removable partial denture designs. The model would be a very useful reference for dentists in drawing removable partial denture design sketches in routine practice, reducing not only out-of-clinic time, but again reducing disparity between clinicians. Oral submucous fibrosis is a multifactorial pre-malignant condition. The aim of this study was to develop a user-friendly software program to study the descriptive epidemiology of oral submucous fibrosis, which will be easy to handle, very economical, and facilitate online data feeding, which will be faster and error-free. Many patients with OSF have other habits concurrently, which may also play a role in the initiation and the progress of this pre-malignant condition. Results indicated that the program was easy to use, socially feasible, found to be portable and distributable over LAN for multiple users. In addition, data analysis of different habit patterns, such as exclusive habits with their duration and mouth opening, and detail analysis of multiple habit patterns was made possible due to the sample size of over 2,000 sufferers, allowing for clinical analysis of various symptoms, gender-wise clinical grading, other associated lesions, and bioprogression of OSF patients, something that had not been done to this scale previously. It was noted that there was a potential to develop a mobile application. This feature enables the clinician to actually point out the patients who require frequent clinical monitoring to prevent any lethal change in patients' oral cavity and thus increase their longevity and allaying the progression of OSF. The overall goal of this study was to develop a decision support tool for dental hygienists to guide primary care screening and care coordination at the chairside. Based upon a public health understanding of prevention as the cornerstone of overall health and well-being, the 4 elected categories were tobacco use, hypertension, diabetes screening, and nutrition counselling. Structured multi-step algorithms were created to provide decision support to dental hygienists at the time and location of decision-making. While these algorithms were created using evidence-based guidelines endorsed by authoritative professional bodies, they were adapted to incorporate dental hygiene. The program is now being introduced via a staged process to allow for a rigorous evaluations of its impact on the structure, process, and outcomes of dental care encounters. While there are notable examples of new and potential decision support systems, this review still shows that despite methodological contributions, theoretical frameworks, and prototype developments, these technologies are not yet widely spread, at least with their full functionalities, in routine clinical dental practice. Further research, testing, evaluation, and training are still needed for these tools to be adopted in clinical practice and ultimately illustrate the benefits that they promise. So why is this important? When you go to see your dentist, you expect that the clinician will be able to provide you with the best available care. Evidence-based clinical decision-making is based on 3 pillars: scientific literature, the physician's experience, and the patient's expectations. However, the sheer volume of knowledge is increasing every day, and it is increasing at a much higher speed than our capacity to deal with it. The World Health Organization calls it the no-do gap. We don't have all the probabilities calculated yet for every clinical presentation. But what we are hoping for are decision support systems. Time is an important factor, and we must use modern information technology to bring down this huge pile of papers to a set of information that is relevant to the clinical parameters for a particular condition. It will require standardization that is integrated into all decision support systems, as well as electronic health records that speak the same language. In summary, we need to shift from the clinical knowledge and papers and large volumes and meta-analysis and Cochrane reviews, etc., to an interactive system using the knowledge available and tailoring it to the patient in question. So to narrow this no-do gap, we need to invest in decision support systems that provide the relevant information to the clinician in an easy-to-use format and can be combined with a physician's experience and patient's preference to be able to provide the best available treatment to that particular patient, changing the paradigm of modern dental care. Thank you.